Namaskar. Today we are going to look at the most common spinal ailment. Every now and then we hear about someone suffering from slip disc. This condition is also known as ruptured disc or prolapsed disc. Let us see what exactly happens in this condition. What is a slip disc? Many of us know that our spinal vertebrae are placed one above the other. Between these vertebrae, there are rubbery cushions called discs. Each disc has a soft, jelly-like center padded by a tough, rubbery exterior. Sometimes, some of this soft, jelly-like thing pushes out through a tear in the rubbery exterior. This condition is called as a slip disc. Now, let's find out what causes a slip disc. The lumbar spine is supported by the muscles in the back and abdomen. The forward bending muscles are strong shock absorbers. If someone has a poor muscle tone or muscle disharmony, the disc has more load, and so this can cause into a slip disc. This condition is also caused by the degeneration due to aging. This is because the disc becomes less flexible and are susceptible to tearing and rupturing. Even with minor strain or twist or jerk, there are times when people can't figure out the cause of their slip disc. It could be because they use their back muscles instead of leg muscles and thigh muscles while lifting heavy objects. Twisting or turning while lifting also can cause slip disc. On a rare occasion, a slip disc could occur as a result of fall or blow to the back. There are also other factors that would cause slip disc. One is occupation. Some people have jobs which requires them repeatedly lift, pull, push, bend sideways or twist. This can increase the risk of getting slip disc. Secondly, genetics, which can also lead to predisposition which develop in this condition. Lastly, the habit of smoking. This causes less oxygen supply to the disc and may cause them to rupture more easily. It is interesting to note that more people have no symptoms in slip disc. Some others show the following symptoms. So understand what are the symptoms for slip disc. Back pain and leg pain are the common symptoms. Very often patients complain stiffness in their lower back. This happens because the muscles go into a protective spasm. The severity of muscle spasm is usually observed during forward bending of spine and decreases during bed rest. And now let us discuss the most important part. How to manage this condition with the help of yogic techniques. So let's understand yogic management. Yoga gives great importance to 4 pillars of lifestyle management: ahar, food; vihar, relaxation and recreation; achar, behavioral pattern, vichar, thought process. Ahar deals with diet and nutrition. Let us look this aspect in detail. Taking a sattvic ahar is important as it is low in calorie. It should be fresh, natural, and supports our nutrition requirement. Drinking enough water daily is essential. Fluid intake is also supplemented by drinking buttermilk, coconut water, herbal and fruit infusion tea, herbs infused water, and so on. The concept of mitahar is required. Person should eat only as much as your body requires, only to satiate your hunger. This will help in proper functioning and health. So, one must fill half the stomach with food, 1/4 with nutritious fluid, and leave 1/4 empty for proper movement of food and the formation of gases. Eat more dietary fiber as it stays in stomach for longer and forms bulk to prevent constipation. Regular cleaning of bowels is essential, as when one is constipated, it will give quite a lot of pressure on back and increase the risk of slip disc. Take small frequent meal for better absorption. and to get the feeling of satiation. Snacking between meals should be avoided. Keep your dinner light by including soups. Try to eat at least 3 hours before sleeping and take a little walk after food. Stay away from all kinds of tamasic food. Food that is stale, fast foods, beverages, and food that is heavy, difficult to digest. High protein diet, non-vegetarian food should be preferably avoided. Now next, let's discuss Bihar. Bihar involves rest and relaxation. Sitting can aggravate the pain. Hence, belt or lumbar corset should be used. Rest on firm bed for 2 to 3 weeks. Bed should not be hard. You should have mattress but a firm mattress and lie down in that position in pranayam number 4. During bed rest, keep your feet against the wall or on the raised platform or pillow. That is advisable. To keep your spine in a good health, walking is an excellent exercise. Swimming is also advised for people who suffer from slip disc. For mental well-being, keep in touch with family or close friends. Sharing joys and sorrows are so important in life. When in pain, use hot water bag or heating pad on your lower back. Support the back while coughing or sneezing. While traveling, avoid carrying heavy bags. Better have a trolley or a bag with wheels. Always sit with good lumbar support for your lower back, shoulders and feet. Feet should be rested on a low stool. While standing, keep your body weight evenly balanced on both the feet. One must lift object from the ground while bending the knees and keeping the back straight, not bending forward. For at least 3 months after one has become pain-free, driving and sitting continuously for more than half an hour should be avoided. All this was about Vihar. Now let us understand Achar, your daily activities. One must return to normal activities after 2 to 3 days of bed rest if the pain is caused by muscle strain. Too much rest can actually make the pain worse and reduce muscle tone and flexibility. When there is pain, one should only do relaxation techniques like Yogendra Pranayam 4, Shavasana, Makrasana and Dradhasana. Shavasana is painful for overweight people, especially when they have back pain as the spine gets curved. So they should avoid Shavasana. They should always rest on the side with pillow giving some support on your knee so that the position is more comfortable. When the pain subsides, one should start with gentle exercise with intermittent rest. Continue to use the bed. Be aware of posture and avoid forward bending. While lying on the bed, one may do straight leg raise. If there are no discomfort or spasm, one may do normal activity. 2 types of strength training moves benefits lower back: flexion and extension. In flexion exercises, one bends forward to stretch the muscles of your back and hips. In extension exercises, one bends backward to develop the muscles that supports the spine. Depending on the cause of back pain, there are some exercises that one should not do. Please check with the doctor to understand what exercises are safe. There are different types of things. One is spondylosis, one is spondylolisthesis. In spondylosis, you don't bend forward, but in spondylolisthesis, you definitely bend forward. So you should know very well what is the problem. Check with doctor and then fix with your exercise. When the pain is not very severe, one may start with Supta, Vakrasana, Haspada Gushthasana, Bhujangasana, single leg Shalabhasana and Pavan Muktasana. As the back muscles strengthen, introduce Haspadasana, Yoga Mudra, Konasana, Sukhasana, Vajrasana and Nispanda Bhav. End every asana session with Yogendra Pranayam number 4 and any relaxation technique. Finally, we come to the yogic concept of vichar. Vichar involves our thinking process. To achieve balance and to have control on your health, acceptance of the problem is very important. Practice anitya bhavana and realize that this condition will change for the better. When we have pain in our body, we usually feel very sad, disturbed, upset. We can't do certain things, so we feel helpless. But all these problems are temporary. The moment you become strong, the moment you start attending to yourself, this pain has to go. Pain comes to teach you something. The way in which you are thinking, the way in which you are leading your life, somewhere there is a problem, so the pain. Learn from your pain and see that you don't repeat the same mistakes again in life. How we lift the weight, how we stand, how we sit, all this is very important. Body always gives you a signal. Whatever you do, body will tell you whether this was hurting body or not. Listen to your body's signal and immediately make changes, immediately understand and don't do mistakes again. So there is always a chance of improving to a better level than what you were before after such a pain. Now you have a knowledge about the condition of slip disc. This knowledge should empower you to make change. Become equipped with the 4 lifestyle concepts of ahar, vihar, achar and vichar and heal yourself in a holistic way. Namaskar.